Welcome back to Our Community. Susie Thomas visiting with Dr. Rick Sternholm from Surgical Associates of Canton, talking about Breast Cancer Awareness Month and some other things that go along. Help me through the process. The first thing would be a person gets a diagnosis. What happens then, and what leads a person to you in your office?
Sure. Some people may not even have a diagnosis yet when they come to see a general surgeon. They may just have had an abnormal mammogram that showed either calcifications or a new lump or something that's not going away, or as I mentioned before, maybe a nipple discharge that's unusual, something like that. But oftentimes the primary care physician, whether it be OBGYN or family practice physician, will send them to our office with this abnormal screening tool, basically, either a mammogram or an ultrasound or whatever they had. We'll generally look at that before we see the patient, meet the patient, and so we'll kind of know what's going on. We'll review their history and so forth and their risk factors. But then when we go to see them, we'll generally talk to them and find out when all this started, maybe if they've had any other previous, breast lumps that were ever biopsied, anything like that. Mm-hmm. And then generally we'll make recommendations on where to go from there. So, for instance, if they had an abnormal mammogram that showed a lump or something, then we might recommend doing a biopsy of that.
There is nothing easier to put off than getting a mammogram.
Sure,
that is probably the easiest thing to put off. Tell us why we need to not forget to have that every year.
Well, the unfortunate part about that is, every once in a while we'll get a nice, really nice lady or patient that came into the office that now they have this new lump or breast cancer diagnosis even, and they say, well, I put off getting a mammogram because I was helping mom, she just passed away, or this, that, and the other. Some very good reasons why they may have put off getting a mammogram. But then there's this new spot that we could have found or picked up earlier. So again, I want to go back and stress the importance of finding early detection and pickups on the screening tests.
It's not a fun exam.
I've heard that. I've been told that, and I agree that it must not be.
So then the next day has to be the spa. So I think that's a good way to do this. Okay, mammogram, and next day, spa.
Sure.
You've got that to look forward to. So let's talk about some treatments.
Yeah, so let me, as a segue to that, so when the patient would come in to see me in the office, then we generally make recommendations for a biopsy. Once we have the biopsy test come back, now that can take anywhere from 3 to 5 days to a week. Once we have those tests back, then the patient will come back to see me in the office for those results. Mm-hmm. And if it turns out to be a cancer, then at that point we have to make some decisions.
Okay.
At that point, I'll usually talk to them about what our options are. And again, this is one of those things where you go back and 20, 30 years ago, people had this people still had this conception of breast cancer is requiring this major invasive surgery.
You either have a mastectomy or a double mastectomy.
Right, mm-hmm. Exactly. And we've come a long way in our treatments and our treatment options.
So what are the options now?
So the two most common options that we offer for new breast cancer is either going to be what we call breast conservation therapy, which would be something like a lumpectomy.
What exactly is that?
A lumpectomy is where we remove the breast tissue around a cancer.
Only.
So we're not removing all of the breast tissue. That's mm-hmm. a mastectomy. Mm-hmm. We're removing the lump or the breast tissue around the breast cancer itself.
And how do you know that you've got it all?
So that comes when we get the actual final pathology back from after the surgery. Mm-hmm. We don't know that till we see them in the office again from that. But when we see the patient, we diagnose the new breast cancer, we talk about the treatment options, and one of those is the breast conservation therapy or a lumpectomy. And then when we always talk about a lumpectomy, we talk about doing radiation therapy after that. And the reason for that is because although we're preserving the breast tissue and doing almost a minimally invasive type surgery, in order to get the risk of recurrence and the same results as the mastectomy, we have to do that radiation therapy.
Okay, so radiation rather than chemotherapy.
Yes, two different things.
Mm-hmm.
So radiation therapy is where they use radiation beams targeted specifically at the breast tissue, and they've come a long way.
I was going to say, doesn't that cause cancer?
Yes and no. I mean, it doesn't. The beams that they're using for the breast cancer treatment are specifically targeted at the breast, and there are some there are some people who would not be candidates for that, such as those who had previous, Hodgkin's lymphoma or something where they got radiation treatment for something else. Then they would not be candidates for that. So important
it depends
to tailor
on the
that.
case.
Right.
It depends on the person and the patient.
Exactly.
Okay.
Exactly.
But now you've started to say, and I apologize for interrupting you, that it's not what it used to be. Radiation therapy is not what it used to be as well.
Besides the risk that you just mentioned, there used to be risks of burning the chest wall or the lungs or the heart or anything like that, but they've come such a long way with their accuracy and their treatment of therapy that it just targets the breast tissue, and that's why we don't see a lot of this other side effects and side complications associated with radiation. So
that would be one of my options. Yes,
one option would be a lumpectomy with radiation,
mm-hmm.
and then the other one would be the mastectomy.
Okay.
And there's different reasons why people choose mastectomies, and I would say by far the most common reason would be just because they don't like the idea of having to go through radiation. Well, there are some people that might benefit also from having mastectomies if they're much younger. And they have a lot longer to go for having potential risk for developing breast cancer, down the road. But in general, people with those options, if they're concerned about the radiation, then we usually address that in the office because it's generally very well tolerated having radiation therapy.
What would be the side effects of radiation?
Usually just skin irritation. There's sometimes some blistering with skin irritation, and also just some discomfort that tends to persist for up to even a few years after the surgery.
You should never do this, but I'm going to anyway, because I just want to know. You should never ask a question you don't know the answer to, but here I go. Suppose a young person goes through this, young 18, 19 years old, and then later on they get married, they have children, and they would like to nurse. Is there still a way to nurse a child after you've had this treatments and so forth?
Yeah, you're talking about if they've had a lumpectomy
yes.
and they still have the majority of their breast,
yes.
and they still have if they still have all the anatomical parts that would be amenable to doing to nursing, then yeah, certainly.
So that would make it one of the things to really consider before going with the mastectomy.
Correct.
If you're a young person. I've also heard of people doing preventative mastectomies, just having them, like movie stars doing this, and I'm thinking, why? So why would a person do that if it were not necessary?
We go back to the overall risk factors associated with maybe a younger person. That would be one. Again, I know we just talked about that, but one of the people that you're referring to, I believe they had a genetic predisposition to a cancer. Specifically to breast cancer and maybe ovarian cancer. And so that would be a situation in which people might be more at risk for developing multiple breast cancers. And so those people who have genetic testing and are found to have these risk factors may opt to have what we call a prophylactic mastectomy along with their mastectomy for the breast cancer. And at that point in time, that's when we would call that a double mastectomy or a prophylactic mastectomy.
How did you settle on October as Breast Cancer Awareness?
Well, I had nothing to do with that. But
you didn't pick?
But we do celebrate that in the office. We have signs up, and we have actually pink examination gloves in the office, and I think you've probably all seen sports athletic people with pink on their jerseys or on their shoes or whatever.
You even go into stores now, and there's the hats and gloves and ribbons and everything. So it's become a real thing, hasn't it?
Yes.
How are we doing as far as combating this? We have the walks every year. There are relays. People are surviving like never before.
Right.
How are we doing against breast cancer?
I think we're doing a really good job. Again, it comes back to early diagnosis. We talked about some of the surgical treatments, but in answering your question about how we're doing, there's also medical treatments as far as after someone has surgery. It really depends on how involved their cancer is at the time of diagnosis. And again, if someone has a late finding with breast cancer and it spread to the lymph nodes or to the bloodstream or something like that, then they might have to have chemotherapy. As well as the radiation treatment. So these are things that we all have to kind of talk about to the patient when they come into the office, all depending on their staging. And to that effect, I just want to say that we don't know the staging and the ultimate staging until the patient has had surgery. So sometimes people will come in and they'll say, well, what's my staging? And we won't know that until we do until we do surgery.
Okay. You have a very tough job. You have to give people some bad news, but
Yes.
you also get to give people some good news.
Correct.
Can you talk a little bit about your own journey with all of this?
Yeah. And I thank you for that opportunity, because for me, it really is an opportunity to speak life into someone's journey, because sometimes we do have to give bad news, and that's hard. But sometimes we do have a biopsy that comes back, maybe it's not a cancer, and they thought it was, and that's such a relief for those people. But I think even in the times when we do have to deliver bad news, I always try to do that with the fullness of grace, and just to try and really help those people through that time and difficult time, trying to put myself in their position and what it would be like to be given that diagnosis. And so we always try to make people feel as comfortable as possible. Mm-hmm. I know that's hard.
How important is faith when a person is going through treatments and so forth? And I've even heard a positive attitude can make such a difference. But what part does that play?
I think it's a tremendous part. I think that we can do all things through Him which strengthen us, and I really believe that if we have a positive attitude, that it really just helps our body to fight and to keep our natural defenses up that God has given us. And I think that it creates a more healthy environment for the body to just all those hormones and so forth that go throughout the body, endorphins and so forth that are related with that. I think that that's a tremendous benefit as well.
So Mary Hart does what good like medicine.
Exactly.
And then let's talk about that. You work with the Cancer Center at Altman Hospital. Mm-hmm. Talk about that environment, because Rick, that is a happy place, and I don't understand how.
Yeah, well, I think those people are filled with joy as well. I think that they have a tremendous heart for the people that they're serving there. When we refer patients over there for either biopsies or for treatments and so forth, we always get good results with the people coming back and saying that they had a positive experience there. So that is one of the places that we use a lot.
What's the best way to get in touch with you if people have more questions, or who should they contact if they have more questions?
I think if they have general questions about a breast lump or something like that, I think that's what the best benefit would be to them. If they just talk to their primary care physician about coming to see us over at our office, and we'd be happy to answer questions.
And your office again is located?
Our office is located here in Canton. It's just off of Tuscarawas and on the north side of the Altman Hospital there in the physician office building. But again, we do go to multiple hospitals in the area. Mm-hmm.
Your website?
We do have a website, and I don't have it memorized, but we'll try to put that on the...
we will have that website on our website.
That'd
we
be
will
wonderful.
Make sure we would do that. Do you have a phone number?
Yeah, we have a phone number. It's 330-455-8000.
Give it one more time, please.
455-8000.
Dr. Rick Sternholm, thank you so much for all you do in our community.
Thank you, Susie.